Nice. 21 years ago, I came to Dartmouth with a head for science, a heart for social justice, and 6 red letters imprinted on my forehead. Pre-med. Any pre-meds out there? Couple. All right. Sorry in advance. So the truth was, I didn't have a clue. I was a bright-eyed, wide-eyed boy from Wisconsin, and I wanted to make a global impact, but I didn't even have a passport when I came to Dartmouth. My parents both worked for the public schools, and from them I learned 2 things. I learned to pursue a life of service and to constantly stretch myself out of my comfort zone. But coming here as a Midwestern middle-class kid, it took me a long time before I really felt at home here at Dartmouth. And then I found South Fairbanks and DCSI. At a project fair, I met a senior named Kyle. He was wearing a wrinkled denim shirt, and you know Kyle, yeah. He was like, he's towering over me, maybe like 6'13", right? And he said, so what are you into? And I said, well, I'm pre-med. He cut me off. Blood drives. We need a new leader for the blood drives. I was like, I've never volunteered I've never even given blood. I can't organize the blood drives. But then I thought about it. Service and stretch, here's an opportunity. So I said yes. And as I started spending more and more time in South Fairbanks, I started to feel more at home here in Hanover. 1 year later, a crisp navy blue passport arrived in my Hinman box. It's my ticket to the world. I've been selected to join a Dartmouth medical team in rural Nicaragua, of all places. And we'd be training midwives and staffing a clinic in a little village called Hormiguero, literally the anthill. And this was my first time outside of the US. It was my first time working in a clinic, and it was my first time witnessing extreme poverty. Every night under a thatched roof, we reflected on the patients that we saw that day in the clinic. We saw hundreds of children who were wasting away from parasites because they didn't have access to clean water. We saw dozens of mothers who were battling pneumonia because they were cooking over open stoves. It was a lot to process. But I was surrounded by this community of like-minded changemakers. And though I was further away from Wisconsin than I had ever been, I'd never felt more at home. And on this anthill in the middle of the jungle, I started to realize that medicine only solves the symptoms of poor health. And bit by bit, the red letters on my forehead began to fade. It was just 3 weeks later at a luncheon that it was fate, or maybe it was free food, that brought me to this luncheon where Dr. Tommy Clark was sharing his story, his journey of starting Grassroots Soccer, an NGO that uses the power of sport to fight the spread of HIV. And I was super inspired by the work they were doing. I went up to him afterwards and said, how can I help? And he said, well, we have this intern program. When you graduate, you can come intern in Zambia or South Africa. I said, that sounds amazing, but I'm a sophomore. How can I help now? He shrugged his shoulders. He said, you got any ideas? Here was another opportunity to serve and to stretch. And naturally, I went back to my dorm room and I wrote him 3 pages of ideas. And most CEOs, we've got some CEOs in the room, most CEOs would just ignore such a thing, but not Tommy. He wrote back, let's get coffee. Naturally, we both ordered tea. But I came to intern with Tommy that summer, and I'd take on whatever job he would throw my way. We were writing grant applications. I got to manage our website. I wrangled our Salesforce donor database, got to plan fundraising events. It was an amazing experience, and I got to work directly with this medical doctor who, for some reason, wasn't practicing medicine anymore. He had used the skills and the superpowers he had to move into social entrepreneurship and run an NGO, and he was having more of an impact in this work. And so, too, I realized maybe would I. When I graduated, I moved to South Africa to keep working with Grassroots Soccer. And we were working to scale our programs around Southern Africa. Zambia, Zimbabwe, Malawi, Lesotho, Namibia, Mozambique. My passport ran out of pages. And one day, a colleague came to me and gave me a jump drive. You guys remember jump drives? Yeah, that's how we used to share files. Cool. So it had 6 years of spreadsheets on it. This was how we were tracking all of the data for all of our programs, all the groups that were coming through our programs across Southern Africa. And I said, there has to be a better way to manage all of this than spreadsheets and labyrinths of spreadsheets. And I had this wacky idea. Maybe we could use Salesforce, the same platform we had for managing our donors and donations. Maybe that platform could be used to track our programs and our participants and our outcomes. And this came to be a really powerful idea. We built a system that changed the way the whole organization worked. Instead of having one-way flow of data from the field to the local office to the head office to the funder with no feedback loops, we went to a system where everybody had data that they needed to do their jobs. And then other organizations started coming to us and saying, this is what we need. How do we do this? But we work in gender-based violence, or we run a clinic, or we work in youth development. And so we spun out Vera Solutions as a B Corporation to help organizations go through that transformation, to save the sector time, money, and headaches, to deliver data solutions for social change. 15 years later, Vera's worked with 450 organizations, from the Gates Foundation to the WHO, to Save the Children, American Red Cross. Our systems are used to manage over $12 billion of programs and grants around the world, and we're saving the sector over 250,000 hours a year. And more important than all of that, and more important than the 60 countries that my passport has taken me to, and the red letters fading from my forehead, more importantly, I've surrounded myself with 140 teammates who are mission-driven, working every day to amplify the impact of the social sector. And what I've learned is this: between this space of service and stretch, work never feels like work. And when you surround yourself with a community of like-minded changemakers, whether you're in South Fairbanks or South Africa, you're always at home. Thanks.